Americans are protected from surprise medical bills. Surprise ambulance rides
I just feel like this bill is outrageous.
are another story.
We kind of just feel a little bit stuck because these things do happen.
Why one ambulance provider supports a bill that could save patients thousands of dollars.
I think on both sides there's a compromise here.
And a Milwaukee man's stolen car scrapped.
I said, I didn't sell it to anyone.
Why he wants the salvage yard to cover his losses.
And at minimum, they should take responsibility for that.
The legal document the salvage yard did not require, but didn't need to under Wisconsin law.
I have no understanding of that at all.
From the Fox 6 studios, this is Open Record. I'm Bryan Polcyn, and I'm joined today by Fox 6 anchor Carl Deffenbaugh. Carl, welcome back once again.
Great to be back.
And we are joined by Contact 6's Jenna Sachs. Hello, Jenna.
Hello.
We are recording this episode on Wednesday, January 21st, and we're discussing a couple of Contact 6 reports today. First, a proposed bill in Wisconsin that could change how health insurance plans cover ground ambulance rides. It has the support of one ambulance provider, but one association that represents health plans has concerns. We're going to interview Bell Ambulance a little later in the podcast. And second, we're going to talk about a Milwaukee man who wants a salvage dealer to pay up after his car was stolen, then scrapped without the title. As Contact 6 found out, buying a car without a title for scrap is legal in Wisconsin, and that plays into the whole complication. We're going to dive into those stories when we come back right after this on Open Record.
We are back here on Open Record. Jenna, you've done a number of these stories on surprise ambulance bills going back to 2022, and it was interesting learning from your reporting here. All of this began with the implementation of the No Surprises Act, which has helped out consumers in many respects, but not specifically for ambulance rides. That's a kind of a glaring exception here. Let's start big picture. The No Surprises Act. What is that? What does that cover?
So the No Surprises Act was passed in 2020, and it was signed by President Trump in his first administration, and it had wide bipartisan support and brought sweeping consumer protections to medical billing. And it does that by protecting consumers from out-of-network bills in emergencies, because when you're in a true emergency, you often don't get to choose which hospital you go to, which doctor you see. So this protects consumers by ensuring they get in-network rates. And when we use the term balance bills, what we mean is a difference between what the doctor charges and what your insurance covers. So if the doctor charges $300, your insurance covers $200, you pay $100. It also,
and this applies to emergencies, right? Not like any other doctor visit, not part of this surprise.
Well, I will say it also
or...
applies to out-of-network bills or for out-of-network providers at in-network facilities. So let's say you go to have a baby at an in-network facility, you will no longer be surprised by learning, oh, the anesthesiologist today was out of network. I've heard about that complaint to Contact 6 before. So you have to get charged the in-network rate in those situations, which used to be issues we heard about at Contact 6 all the time. But the glaring exemption to this law, and they knew it from the beginning, was ground ambulance rides. Air ambulances are covered, but not ground. And the reason for that is ground ambulance rides are a bit more complicated because sometimes it's managed by the local government. Sometimes it's a private business that's providing the ambulance response. So at the time the No Surprises Act was passed, they came up with a commission that got together and reviewed the issue, came up with recommendations, suggested caps on, the billing to help consumers. And now it's really been up to the states to take steps to try to pass legislation that addresses this issue. And many have, and now Wisconsin is taking those steps.
So if I understand, it was the complexity. They were basically saying, let's not hold up the rest of this act over this one complicated area. Let's get this thing passed, and then we'll deal with that. And now this is happening state by state.
Exactly.
I recall you doing stories because obviously when people get these surprise bills for thousands of dollars, many times they come to Contact 6 and go, I don't know what to do. You've dealt with a lot of these, right?
We deal with much fewer than we used to before this bill went into effect. So that is evidence that it is protecting consumers, but we do still hear occasionally about ambulance bills. In the past, we've primarily reported on one business called Superior Ambulance out of Illinois. That is a business we tend to get more complaints about their rates. And when we reported on them first back in 2020, we did solicit rates for them compared to other ambulance providers, and they were charging more for their base rate. I believe at the time, Superior's base rate was $6,600, and their competitors told us they were charging between $1,900 and $2,400. So that could be 2 to 3 times the charge. At the time, Superior had said, we stand by our rates. This is the cost of our operations, and we can't comment on what other people are doing. I did reach out to them for comment on this legislation, but didn't hear back.
It's a good reminder of the layers of complexity to our health insurance system in America,
That's a
too,
good
and how
point, yeah.
complicated and how expensive things can get quickly.
Right. And people might assume that all ambulance providers charge the exact same rates for their services, but they don't. It varies from one provider to the next as consumers find out.
And in so many areas of life, we can decide, for instance, do I want to buy, I don't know, do I want to buy a Toyota or a Lexus? Do I want to buy I look at the price, I look at the value, what do I get for the product? And I make a consumer decision. But in healthcare, it's often not like that, especially I feel like with ambulance rides. I don't know that anyone is sitting at home going, should I take Bell or Superior? They take the ambulance that comes, right?
Right. You often don't get that choice. And I have reported on people. There was a gentleman named Michael. He had a heart attack. This was back around 2022. And the ambulance only took him 4.7 miles. And he ended up with a bill that was for thousands of dollars from Superior Ambulance, even after insurance had chipped in. I think it was upwards of $5,000 or $6,000, and that was after insurance. And when we talked to his insurer at the time, they said, well, we reimbursed 20% more than what Medicare reimburses for this service. But those in the ambulance industry will argue that they are underpaid by Medicare. Their reimbursement doesn't cover the full cost of services. That's a whole other story we've covered as well, and they're working on that issue, trying to get some changes with the Medicare reimbursement rate.
So the No Surprises Act happens at the federal level and kind of helps with a lot, but not this one glaring issue. Where do we stand now with the states kind of left to figure things out on their own? Because a number of them have, and Wisconsin's kind of in that process.
We are in the process. So far, 22 states have passed legislation that addresses this issue. And interestingly, it's a mix of red and blue states. So Texas has done this, so has California, New York, Indiana, Illinois. And what they're doing is they're setting different rates. There's not a whole lot of variation, but there is some. So the Texas law says that EMS services must be reimbursed at a rate at least 325% the federal Medicare reimbursement rate. Indiana's minimum rate is 400% the Medicare reimbursement rate. So that is much higher than what a lot of health plans are covering right now in Wisconsin. When we speak to Bell, they can speak more about this, but often insurers will try to be closer to what Medicare reimburses, which, as ambulance providers would say, doesn't fully refund them for the cost of their services, the cost of the readiness, all the equipment and the ambulances. And a lot of ambulance companies are really struggling right now. But in the meantime, without this kind of legislation, the consumer's left in the middle.
It's interesting because we hear this so often from healthcare providers that they say, look, the Medicaid or Medicare, the reimbursement rates are lower than what we charge. They're too low. They don't cover our costs. They're not enough. And when government then comes in and says, and by the way, Medicare and Medicaid are operated by governments, but when government comes in and says, well, these must be covered up to this level, who pays for that? At the front end, it's the health insurance companies. So I would imagine when a state law says you're going to pay more than 3 times what Medicare pays for the same service, the insurance companies might balk at that. Are they balking at this legislation here in Wisconsin?
Yes. So I reached out to the Wisconsin Association of Health Plans, and I got a statement from them, from their CEO, John Nygren. And he said, yes, we do want to protect patients from these balance bills, these surprise ambulance bills, but he worries that this legislation will mean higher costs and higher rates for consumers. He said people who have health coverage should not be charged by ambulance companies because the ambulance company does not want to negotiate rates with the health plans. And he said that this bill in particular set an arbitrary and above market rate for ambulance services. So in this case, it sounds like the health plans are saying the ambulance companies aren't negotiating fairly with us. And the ambulance companies are saying the health plans aren't negotiating fairly with us. And the legislator who drafted this, Representative Kurtz, or who introduced it, said he felt like there was compromise here, and they're attempting to find some compromise.
And that's what it seems to me, that it's moved the negotiation from a private negotiation to one that's out in public in Madison, where you say, if we can't agree on the rates there, then we need to agree on them here. But I do wonder, and we're going to talk to Bell Ambulance in a moment, if you have a company like Bell that's willing to work out what both sides agree are reasonable rates, but maybe you have another company you've reported on Superior who says, nope, we're going to charge what we want. Does that end up becoming one where rates from the higher charging providers start to impact others? Is that part of what's at play here?
I'm not sure if one provider's rates impacts what others are charging, but I do know Bell Ambulance thinks this would help them because then they would get more money from insurance plans, from health plans before they have to go to the consumer. And then they don't have to work with the consumer who maybe can't pay that amount, or they have to take those phone calls from consumers who say, I have health insurance. I don't understand why this isn't covered and why I got this huge bill, especially when I was under the impression that it wouldn't be this large.
Since we'll hear from Bell Ambulance, I'd be curious if you could explain a little bit more the insurance company side of it. I'm sure we'll ask the representative from Bell about this, but what the insurance companies are saying the ambulance companies are not doing when it comes to that negotiation. It makes me think to those massive stories we covered last year where people lost, I believe, Ascension healthcare coverage for a while because of the negotiations back and forth and the inability to reach a common ground. What do the insurance companies believe the ambulances are not willing to do or not willing to give?
So one thing I think a lot of people don't know is that ambulance rides and ambulance providers are out of network with almost all health plans. So there's no in-network rate for a lot of people in these situations. And the people involved on the health plan will say they're not negotiating enough with us. They're not really coming to the table with a fair rate. But then it's hard to know where the true balance lies when you've got two sides saying the same thing. They won't come to the table. They won't negotiate fairly. What is a fair reimbursement? On one hand, we have this health insurance company that's trying to stay afloat. We've got these small ambulance companies that we know are trying to stay afloat. They speak to their difficulties in rural areas in particular, and also retaining staff, paying them enough, getting all the equipment they need, because we do need these services in our communities. If we don't have them, we're all at risk of not getting the care that we require. So it's that balancing act between finding what both sides want, and hopefully this legislation will do that. But it seems like the health plans aren't happy with it so far.
I feel like I have more questions, but they're probably best for Scott Mickelson. And that's who we're going to talk to next, right? He is with Bell Ambulance. We're going to bring him here on the podcast right after this break.
Welcome back to Open Record. We are joined now by Scott Mickelson. He is Director of Client Services at Bell Ambulance. Thank you so much for joining us, Scott.
Yeah, thank you for having me. Good morning.
Good morning. Can you start by explaining why Bell Ambulance supports this bill? Because you've actually advocated for legislation addressing this issue for a few years now.
In the last 5 to 6 years, we've seen an increasing shift of healthcare cost onto the patient. Insurance companies are paying less and shifting those costs onto the patient. That is very difficult for the patient and for us, the provider. It is a lot easier, obviously, to get paid by the insurance company rather than trying to get paid by a patient who is confused, doesn't understand why they're getting this balanced bill. We feel that there is a compromise to be made so that we're reimbursed fairly and the patients are left out of this negotiation.
Scott, I want to step back for a minute and ask a little bit about Bell Ambulance's operations, because years ago, I remember doing a story on 911 medical responses in Milwaukee. And of course, Milwaukee Fire Department has obviously paramedics and medical units that will respond to people who have very serious emergent situations. And there are certain calls that will go to, to the fire department, certain calls that will go to private ambulance companies like Bell. In what situations is Bell typically being called in to provide ambulance rides? What is the common scenario where you guys are providing ambulance services?
Well, narrowing down just to the city of Milwaukee 911 system, we actually transport between 100 and 150 patients daily for the city through the 911 system. We are one of two basic life support level ambulances that serve the city, and we have for decades. Just to put this in layman's term, say you fall down in your bathroom and you break your leg, the fire department will probably come and assess you, and then they will request us to come and do the transport. It's all about resource utilization. There are only so many Milwaukee Fire Department paramedic units, and not all calls need that level of care. But most of these calls do need some type of care and transport to the hospital.
It's an interesting world that honestly I'm not very familiar with, so I'm glad we have you on here, Scott, as well. Would you be able to describe where some of these costs come? Because I think as Jenna covers from the consumer side of it, it can be really daunting when you see those thousands of dollars show up on a bill. On your side, what is that all entailing when it comes to, I'm not sure, gas, resources, technology to operate some of that life-saving care en route to a hospital?
Great question. Well, we'll start with this. An ambulance normally runs us between $250,000 and $500,000, depending on what size the ambulance is and what it's equipped with. We operate 3 different types of ambulances. We operate basic life support, advanced life support, and critical care ambulances. And as we go up in care level, we go up in cost. A cardiac monitor, that all of our ALS and critical care ambulances have, cost around $40,000 to $50,000. Our cots, that every ambulance has the same one, they are about $25,000, in addition to the equipment that helps load the cot in the ambulance. And that's about another $20,000. So just right there, our costs for the physical ambulance and equipment, times the 80 plus ambulances we have, that's a significant cost.
I would imagine labor cost as well. You've got to have the people who are trained and can take care of people in these situations.
Yeah, all in, we have 800 plus employees, and we at Bella Ambulance believe in paying all of our employees a wage that is family sustaining and can help them move ahead in life.
Scott, I wanted to ask you about the current legislation. It proposes a reimbursement rate of 325% what Medicare pays. Would that eliminate the bills for most of Bell's patients? Would they still see a bill if that rate were provided?
A very quick correction. It's actually 350% of Medicare is what we're asking
excuse
for.
me. You're right.
No, it's okay. There are a lot of different rates everywhere floating around there in the country. We feel 350% is fair to keep us whole and to keep the patient from getting a balanced bill. A patient still may get a bill if they have a copay, a deductible that's not meant, things like that, or if it's an uncovered service that their insurance does not even cover.
How about some of the background? I believe you heard part of our conversation in the last segment, but the discussion of why this is not in network to begin with, what those evaluations have been like between companies like Bell and the insurance companies, and why ambulance services in general are not covered at this point.
A lot of it comes down, honestly, to money. They want to pay the least amount that they can. We can't accept that, or we won't be able to provide the services that we do. Another component is they have some pre-authorization rules that are very difficult, if not impossible, for an ambulance service to follow, even in the non-emergency space, because transports happen day and night, emergency and non-emergency, and it's very hard to comply with some of the rules that the insurance companies want if we're in network.
Can we talk a bit more about that? Because I'm sure you saw in our story, and we discussed this earlier, that the Wisconsin Association of Health Plans has said the bill sets an arbitrary and often above market rate that could actually inflate costs. What are your thoughts on the idea that the rate might be above market or arbitrary?
Well, I think I can point to all the other states that have implemented these laws, that most of them are around the 350% of Medicare. So market rate varies from different areas of the state. What might cost this in this area, because there are more resources, could cost a lot more in a different area because there are less resources, longer transports and things like that. And those add to costs for all parties involved. We just want a fair rate that leaves the patients out.
You know, we're repeatedly talking about something here that maybe is a whole other story and series of stories in and of itself. But when you talk about the going rate in a lot of these states now being 350% above what Medicare pays, or 350% of what they pay. It makes me wonder, why is Medicare paying so little? And how do you then withstand Medicare rates when you're being reimbursed by Medicare? 350% is a significant difference. How has that been determined to be the fair rate in so many places?
I believe you're talking about how is Medicare determined that to be the fair rate?
Well, I mean, first of all, why is the Medicare rate so much lower than the fair market rate, which is an entirely different story? But then it raises the question of why 350%? How do you come to the determination in all these different states where there must be varying conditions that is the fair going rate for these sort of things?
I'll be frank. I'm not. There were quite a few studies nationwide done on what ambulances cost to run versus what it would take for us to continue to provide those services. And that's a number that was generally thought of across many different states. That is the compromise number, the fair number.
When we say compromise, by the way, and I think this is important for people watching and listening to know, is once you accept that, if you get the state to approve that, if that's the legislation and it says that's the rate, that does mean that if you think in a given service this should cost more, you've accepted that, no, this is what we're charging. That's the rate, right? So on both ends, there's a little bit of give and take here.
Yep. And we are perfectly fine with accepting that rate, even if it did, if it costs much more to provide that particular transport than the next. Kind of comes with the territory in the ambulance business. You never know sometimes what you're all going to need, what resources, until you get on scene and do an evaluation.
Jenna brought up the issue of service in rural areas as well, and we discussed some of the service in Milwaukee specifically. Obviously, that's where a lot of our viewers are, but certainly not all. What are the specific complications when it comes to ambulance service and first response times in those rural areas where these ambulance companies like Bell, like others, operate versus a city setting?
Rural areas, it takes longer to get an ambulance and there are a lot less resources. I actually got my start in this business back in the early 90s for a rural ambulance company in Sheboygan County. And we had 3 ambulances. That was it. And the next ambulance was coming from 30, 40 miles away. So that impacted response times. It impacts overall safety of the community. But we were doing the best we can, and we still are in the rural areas with the resources that we have.
Scott, can
ahead,
we keep going? I mean, speaking of ambulance companies, I know you're on a board where you talk to other ambulance providers, but can you keep going with things the way they are, with the Medicare rates being what they are without this legislation? Can ambulance companies, others, not just Bell Ambulance, keep going?
My opinion is no. The biggest ones in danger are these rural ambulance providers, whether they're municipal based, private, hospital based. It is getting increasingly hard to find employees to run on these ambulances and the money to provide these services.
I would imagine that you don't really want to be in the business of chasing down patients for the balance of these bills either, because that's an administrative cost. And it's also, from a customer service standpoint, one that might land you, as some companies have found, on a Contact 6 report. It's the kind of thing that I would imagine if you could come to a rate that was agreed upon, it could really relieve some headaches, right?
It really would. At our core, we are still a family-owned community ambulance service. As such, we got our start and our mission was to help our community. We do not want to tax patients with more bills in most likely one of the worst periods of their life. I actually deal with a lot of with that end of things, and it's an everyday occurrence that we get phone calls from patients inquiring about why they were billed, etc. We do our best to work with these patients, but we can't make all patients happy. We try our best, though.
I do wonder when I talked about that story I had done years ago, and one of the things we actually looked at was people who were calling 911 for reasons that really weren't true emergencies. And so you have someone, for instance, maybe my toe is sore, and they call 911 and they want to go to the hospital, and an ambulance comes. But then you have someone else who has, I don't know, an iron bar through the stomach, and you go, we need to get you to the ER right now. Are those people being charged the same amount under a bill like this? Is it the same cost to bring in the person with the sore toe versus the person who has the, bar of iron through their stomach?
Well, that's an interesting.
That's an exaggerated example.
Have you been watching The Pit on HBO like I have?
Noah Wiley told me about this. No,
Yeah.
but I mean, it's an exaggerated example. But to make the point, is it then one rate for all calls? Is that how that works?
No, there are different levels of service, and these are set by generally across the industry by CMS, Medicare. There is the basic life support level, there is the advanced life support level, and then there is the critical care level. All but critical care have an emergency and non-emergency component of the call as well. So we go back to the toe pain that they may have called 911 for. That's going to fall under BLS, which is a lower rate. When we start talking about the iron bar through the stomach, that is going to be advanced life support, without a doubt.
So the base rates are different for those, and the 350% of Medicare is then
Because a different type of ambulance might respond.
Yeah.
Yep. If there's one available, there are many rural areas that there only is basic life support ambulances.
Scott, I know there have been public hearings going on this topic at Madison. Have you attended any of those, and have you spoken with lawmakers about how optimistic they are about this passing?
Yeah, I've attended both the assembly, public hearing, comment session, whatever you want to call it, and as well as the Senate. I want to take a quick moment to thank both Representative Tony Kurtz and Senator Pat Testin for bringing these bills forward. They have been big proponents of this since we started talking about it. And what I saw when I went and testified, or spoke out, I guess you could say, was several stories about patients that got put in these situations where they didn't have a choice, and all they want was to be treated fairly by all parties involved. And I also saw, to be fair, that I think we're getting there with the insurance companies. I think we're close to coming to an agreement. As the gentleman who represents the insurance companies stated, he believes that we're 90% there. I would concur. We've been having talks with the industry as a whole, and we want to get this resolved sooner rather than later.
Do you feel optimistic before the end of this legislative session that there will be no more surprises for ambulance bills?
That is a good question. There are a lot of stuff going on right now. I really don't know. I don't know either way. There's so much political things going on right now. I don't know if it'll be brought up or not.
Well,
we hope it is.
We're bringing it up here on Open Record. So if you're at home and you have an interest one way or the other on this, obviously you can reach out to your local lawmaker and tell them what you think. Scott Mickelson, Bell Ambulance, we appreciate your time here on Open Record. Thank you for sharing all you have, and have a good week.
You guys too. Stay warm.
That will be more difficult, easier said than done. So in any case, we do have one more story. When we come back, we're going to be talking about a whole different situation. And this is one that is another one that sort of maybe involves where the state law stands. Should a title be required when selling a car for scrap? We're going to talk about that and how it affected one Milwaukee man when we come right back. Welcome back to Open Record. A Milwaukee man wants a salvage dealer to cover his losses after his car was stolen and then sold to the salvage yard for scrap. The person who sold it did not have a title. Contact 6 found out in Wisconsin it is legal to sell a car without a title to a scrapyard. Jenna, what happened to Carlton Jackson? Walk us through this a little bit.
This actually started back in October of 2023, and Carlton noticed 2 vehicles missing from his garage. Carlton has one of those 100-plus-year-old garages.
I was watching the story
Like
and I
barn
thought, man,
doors,
this-
I
right?
was so surprised when I got there. It has no automatic garage door. It's wooden doors that someone
big,
he
large,
says pried
old wooden
open.
barn doors.
Yeah, it's probably well over 100 years old. And someone, he says, came in and took 2 vehicles. One was a 99 Blazer belonging to Carlton, a Chevy Blazer, and one was a Cadillac Fleetwood belonging to his brother. Now, Carlton said he didn't have insurance on his car because it wasn't drivable. He wasn't driving it at the time, and he was fixing it up. So was his brother.
It looked like the kind of place you would hide a DeLorean that was also a time traveling machine.
Right.
You know what I mean? It's
This
like
is becoming a
behind these-
theme here. I
But
like it.
I do keep bringing up Back to the Future. But what was interesting to me is, and you didn't really talk about this in the story, I don't know if you know the answer. How did the guy who stole the cars know there were cars in there? Because from the
That's a
outside,
really
it
good
doesn't
point.
look like a place where you store cars.
Well, and it is interesting because it sounds like the cars were actually sold directly from his garage. But I'll get to that in a minute because Carlton said he immediately called the police. They were able to use his VIN number to track his vehicle, the Chevy Blazer, to a salvage dealer. And he went there with his title in hand and said, "Hey, that's my car." And they said, "Well, this is out of our hands at this point. We bought this car." They provided documentation later that showed it had been 2 days prior that the sale was made. So Carlton didn't notice that the car was gone right away. Carlton was told, "Sorry, you have to talk to police." He spoke with police a couple days later and learned, "Sorry, the car has been scrapped. It's been junked. You can't get it back." And he felt like he should be entitled to some financial reimbursement because his car was scrapped without a title. He tried pursuing this in civil court. It didn't go anywhere. The case was thrown out. And that's because in Wisconsin, you can buy a car for scrap without a title as long as you take other steps and get other documentation. So it sounds like in this case, according to the criminal complaint and the police reports we read, this seller, who the person charged in this case, Aaron Silas, is accused of going to Carlton's garage. A tow driver was called in from Milwaukee Iron and Metal, and the
Silas
sale
calls the tow company.
Silas reports
The
that
thief.
allegedly
Yeah.
this car was this tow truck responds to this garage, and the car was sold there. A form was filled out, a junked vehicle bill of sale. Pictures were taken. There was no key, no title, but the sale was made allegedly right outside
This is
Carlton's
where I was
garage
a little
doors.
confused, I have to admit, watching the
Yeah.
story. Did he sell, did Silas sell the car
This is
to
the second man
to the
who's
tow
on
driver.
trial for the theft.
So Silas is the one man on trial for burglary of this vehicle.
But he sold it to the tow company?
He sold it to the tow driver who was recovering the vehicle for Milwaukee Iron and Metal. So the tow driver took the vehicle
Okay.
directly to the salvage yard. So Aaron Silas did not allegedly go with this car to the
He
salvage
sells it
yard.
right there at the
Right
barn
up-
door garage.
Well,
he's
you can't
broken
drive
into,
it. You'd
right?
have to tow it. You can't drive that car out.
Okay.
So that's
but he sells
it's
it there.
kind
The
of
tow,
wild that
tow
way.
driver is working either. Is it a contract or do they work for the salvage yard? Is
I believe it said they were acquired by the salvage yard to go and pick them up.
Okay.
This whole episode is a fascinating reminder of all the different stories you deal with, Jenna, and
It
all
is.
the
Yeah,
different
really.
issues
This
out
one
there.
took a while to put together because there are a lot of very interesting details about how this crime took place.
It
that took a minute
seems
to get in order.
like it should be, especially from Carlton Jackson's standpoint, it seems like he acted quickly. He tried to get things moving, and yet still his car is destroyed at the end of this.
Right.
The reason that you don't need a title, because that seems like something that would be obvious, right?
Right.
If you're selling a car, you
Is
have
it
the
your
title.
car?
Right.
Right, yeah.
Basic proof. Why is that not required in this case?
We don't know specifically why. We can speculate. And the attorney for Milwaukee Iron and Metal said, well, often people who live on the margins of society don't have a title. Maybe they lost it or they never got one during a private vehicle sale. And I can say from doing past Contact 6 reports on issues like odometer fraud, it can be really hard to track the history of a vehicle because people don't do the proper paperwork in private car sales. So the title is not transferred properly in a number of sales, and that can be a real
so from
issue.
the salvage yard side of it, they could just end up with entire lot full of cars unable to scrap because they wouldn't necessarily have the title. So that alleviates that issue on their end of things, basically.
Well, that they can take the vehicle
Yes.
at all. And they say they have permission to scrap them as quickly as they want to. Otherwise, they would pile up and they don't have the room to store all those vehicles.
Couldn't there be some sort of a waiting period? Somebody sells you a car, especially somebody on the margins of society, sells you a car that we don't have a title, might be yours, might not. Sit on it for 30 days?
Right.
Something.
Well, I think it would be a question of space, I suppose, if they have enough space in that yard to hold vehicles for 30 days. But their attorney was saying, if you have a problem with this, you have to go to the DOT. They're the ones that have the administrative code. You need to go to your lawmakers and try to get a law changed because we're not violating the law.
I'm going to tell you a little quick story as an aside here because it relates to this. Now, this is a salvage yard that's a private salvage yard, right? That's not operated by the city of Milwaukee.
Its parent company is Waukesha Iron and Metal, but they are arguably, I think they're the largest provider of
but
salvage
they're
dealers.
not government. They're private.
No.
Well, back when I was in Kansas City, a little young cub reporter. I wasn't that young actually, but younger than I am now. And there was an issue going on in the city of Kansas City, Missouri, where cars were being stolen, like in this case, and the police department would find out that the cars were at the city's tow lot. This wasn't a private salvage yard. It was the city-owned tow lot. And they would notify the owner, we found your car. And by the time the owner got to the tow lot, it had been sold at auction or scrapped like this. And in that situation, it was easy to say, government, you found the car. Why wouldn't you hold it for a little while? And it was the first interview I ever did where the mayor of a city got up from her chair, Kay Barnes, and walked out on the interview because she didn't like the questions I was asking. And I realized they knew that they messed up.
Yeah.
But this is different. I tell that story because this is a private company. And for them to say, why should we have to sit on this thing for 30 days or hold it somewhere? It's not our fault. We did what we had to do. And what is it that they have to do? They still do have to do some minimum amount of due diligence, right? To make sure that we know who sold us this car that turned out not to be theirs.
Right. And the reason we have a man who's been criminally charged in this case is because of the documentation provided by the salvage yard to police. So if a seller does not have a title, the salvage dealer must get a junked vehicle bill of sale. It's a form that must be signed. It must have the seller's driver's license number on it or their identification card number if they don't have a license.
I think there was a photo of the license in this case, right?
There
So
was.
it had the
I think
photo
many
of the
yards
person
will
too.
take
Yeah.
the photo of the actual ID. In this case, the form was signed by a man, Aaron Silas. It had his name and address on it, and it had a picture of his photo ID. The salvage dealer must also run the vehicle's VIN number to see if there are any liens or security interests on that vehicle. And then the salvage dealer has to keep record of every car, vehicle it acquires and keep that well documented. And because it did those things, we do have a man who's been criminally charged and is heading to trial next month.
We do have, again, going back to Carlton Jackson, the person who had his car allegedly stolen in this case. The attorney for the salvage company, Milwaukee Iron and Metal, has been very forthcoming, did an interview with you for this story, and they are not being criminally charged in any way. My one question is, why didn't they wait, right? Did you ask that question? Did you get any response from the salvage company when Carlton Jackson goes there and says, hey, that's my car, you guys have my car, why they still scrapped it 2 days later?
I did ask them why they don't wait longer, and he said, we are entitled to scrap it as soon as we get it. Under the law, that's what we can do.
I hear what Carl's asking, though, and that's interesting. I hadn't considered that he had gone to the scrapyard and they said, yeah, we have it, but you got to talk to police about it.
Right.
Which
And
he did.
as he's going to
I
talk to
know.
police, they scrapped it, which seems a little sleight of hand
Well,
behind the back, almost intentional.
Carlton says that he saw the vehicle on the lot that day. I was not able to confirm that information, so I can't really say whether he did indeed see his car or maybe another vehicle.
So
but
we don't
feels
know
that
for
he-
certain it was there that day. He
we
says
don't.
it was.
He says it was, but I wasn't able to confirm that. Maybe if he were able to hire a lawyer, he could get further with that kind of thing. But who's going to take a case for the amount of money that Carlton would get as a payout at the end? Probably not any attorney unless he got some
and
sort of free
oftentimes
representation.
he mentioned this car was a project he was working on it.
Yeah.
Oftentimes there was an emotional attachment to vehicles that are projects. It's your stuff. And in the end, if you go, well, even if he could sue Silas, the person who was charged here, he could sue him in civil court for the losses. Yeah, the losses might be a couple of $100 because
Right.
if it was scrapped for scrap metal, it's not going to be worth very much.
Right. And he did describe it. You were right on with the sentimental value. He described it as the church car, car that his parents, they would load all the kids in and drive together to church. So you can't really put a value on that kind of thing. But in the eyes of a scrapper, it's probably not worth a ton of money at this point, especially if it's all dusty and got flat tires and can't be driven.
And we know his solution was better secure that garage door.
Yeah.
We saw how hard it was to get in when
Right.
he went to show used. We are going to take a break. When we come back, we're going to go off the record right after this. And it is time for us to go off the record. This is the part of the podcast where we get a little more casual. We have a little fun by answering a question. This week, Sarah Smith has provided me. She's not here, but she provided me with a question. Let me take a look at what it was. I think what this means is she listened to the last couple of episodes and was like, Brian's questions suck. He needs me. So Sarah sends this question, and it is a food question.
Of course.
But what food item is, capital letters, always in stock in your house?
Oh,
Peanut butter. I eat peanut butter every day.
I do love
You
peanut
never
butter.
run out.
Never.
So if it gets low, you're like, I got to have a couple jars.
Oh, definitely.
in
Yeah,
the
we buy
hopper.
the big jar.
Crunchy or smooth?
Smooth.
Oh, crunchy all the way.
I prefer Jif, not to do product placement, but I will also do Skippy if it's on sale. But I love peanut butter.
I'm not particular about the brand of my peanut butter because, like, I shop at Meijer. I'll do the Meijer ones, but I agree. I get the big giant one, and it amazes me how quickly that goes. We have 3 adult children that are still in the house, and they eat a lot of peanut butter, and I find that I eat more than I realized, I guess, that I did.
Have you ever had that experience where you buy the jar of peanut butter and you bring it home and you realize you bought like natural or sugar-free by mistake?
No,
and then
actually,
you're like, no,
You
I
have
have
to
so
mix
much
it
of
like
it.
you're churning butter every
I will
time.
tell you, it is. Those seem like they suck until you can't have any peanut butter.
Sure.
So right now, my wife and I are doing Whole30, which is sort of an elimination diet thing, and peanut butter's off because it's got sugar. So there's almond butter.
Sure,
which
my kids do that.
By comparison is awful.
Yeah.
But by comparison to peanut butter is awful.
Sure.
By comparison to nothing is fantastic. So it is really, you learn what you can settle for. But yeah, you're right. I guess we always have that too. That wouldn't be my go-to, but I want to hear
what's
Carl's
yours,
first.
Carl?
I have kind of a combo answer for this. You're going to groan at the first one, but we always have apples because for as long as I can
that's
remember, I've had basically an apple a day. School lunches, still work lunches. I bring it each and every day, and got to have my apple as like a mid-morning or
What
There-
kind of
that's
apple?
what I want to know. Yeah.
I have many thoughts on this,
Okay,
and we
I
probably
do
don't
too.
have
Let's
time
hear.
for it. When
Are
you're
we paying
actually
you Honeycrisp money? That's the question.
when you're actually out picking apples, a fresh Macintosh
I
apple
love
that's
those.
crisp is the best flavor in the world. But I think they are often flawed in the grocery store.
Yes.
Lots of bruises, not the best once they get to the store setting. So for that, Honeycrisp is pretty nice, pretty consistent.
Yeah.
Or because we're now all in on Costco, their Cosmic Crisp have
Sure.
been very, very good. So apples I would put up there. And while we're on the Costco trend, the trail mix that they sell, I am addicted to. I get home from work and have to have multiple handfuls, and now the girls are addicted. and
Is
it's
that
bad.
the one with the little fake M&Ms in it?
Yeah, and the girls just mind the M&Ms, and then I only get.
I
the
will
one.
tell you what I can't do though is Granny Smith. If
Yeah.
Granny Smith
They're
is
very
out
tart.
here, you feel it back here. It's so
Do you know
tart.
what would help?
know
Is
that?
some peanut butter.
Yeah, well, no,
Honestly,
you're
true.
right. You're
Perfect
right. That's
pairing,
the
Jenna.
one way I could eat a Granny Smith apple is with peanut butter because that offsets that. But typically, the Macintosh is great for me because it's not quite as sweet.
Right.
It's but the we in our house it ends up being Cosmic or Honey. Really Honeycrisp. My
They're the
stepsons
most
love the
consistently
Honeycrisp.
good, I
And
think.
lately, I've been finding deals on those, like $1.49 a pound. And like this,
That's
is
a really good deal.
Yeah.
That's fantastic because otherwise it's $3.39, and I think, do I need a mortgage on this bag of apples? That's what it feels like these days. But for me, the thing that's always in stock it shouldn't be the thing, but I always make sure there's a box of Cheez-Its.
Oh, you and your Cheez-Its.
These are my Cheez-Its. But no,
But can you eat those on your?
I can't.
full-
No, I haven't touched.
So now you
haven't
just stare
touched
at them
the Cheez-It.
longingly?
I do. I try to hide them where I can't see them. But right now, it's always every week. I always have chicken breasts and ground turkey because I love to cook those up, and you can put them in anything.
True.
It's kind of like the base that you can make almost any meal out of. So I have a lot of chicken, a lot of ground turkey.
But if you could eat what you want, it would be Cheez-Its.
I mean-
Classic, the classic Cheez-Its or the
Well,
white cheddar.
Extra toasty.
Okay.
That extra crunch in the or a real cheesy Cheez-It like the not white cheddar, but they've got another
Yeah.
one that's, so
Jenna,
let's not
is it
talk about
peanut
that
butter
right
and
now.
jelly sandwiches for you, or what are you doing with all of your peanut butter consumption?
My husband calls this my natural habitat, if you catch me in it, which is I will take a banana and a spoonful of peanut butter
And do you just put it right on top? Oh,
put
that's
it
great
on top
combo.
and take a bite. Whenever
I've done
someone
that,
catches me
yes.
doing it, I'm so embarrassed. And then my daughter started doing it, and he's like, "Look at our habitat."
I'm going to
we've
send you a
created."
picture because I just did that recently with the nut butter, the almond butter, just putting that on top. It's like it's a midnight snack. Like,
Yeah.
this is the best I can do.
I would do that with
I'll
celery
do it.
sticks, and celery obviously very healthy, but the amount of peanut butter I would consume
compensate
with the
for
celery
that,
as like a
absolutely.
gateway to the peanut butter was not so good.
Should have known Sarah would get us talking as long as we did. We got to take a break. We'll wrap it up after this. And that is all the time we have here on Open Record. If you have an issue you would like us to talk about an Open Record or investigate for Fox 6 News, send us an email to fox6investigators@fox.com. Thanks to Carl, thanks to Jenna, thanks to Tim Primo there behind the camera running everything, and all the other people who make this podcast possible. I'm Bryan Polcyn. We'll be back next week.